Looking at the half-head respiratory model, we begin with the external nares. The nasal cavity and vestibule, the internal surface of the nose, leads to the nasal cavity. The anterior region of the nasal cavity, near the nostrils, is called the vestibule. The nasal septum divides the nasal cavity into left and right portions. The nasal mediuses, superior, inferior, and middle. The concha subdivide the nasal cavity into separate air passages, each called a nasal meatus. Posterior nasal apertures are the internal nares. The nasal cavity is continuous posteriorly with the nasopharynx via paired openings called internal nares. The nasopharynx is the superiormost region of the pharynx, behind the nose. The pharyngotympanic, also known as the auditory or eustachian tube opening, inferior to the nasopharynx. The oropharynx, the middle pharyngeal region, immediately posterior to the oral cavity. Notice that the lingual tonsils and the palatine are located there. The laryngopharynx, the inferior narrow region of the pharynx. Moving right along to the larynx, is anterior to the esophagus. The laryngeal cartilage, then we're going to start with the thyroid cartilage, which is the Adam's apple, forms only the anterior and lateral walls of the larynx. The cricoid cartilage forms the inferior base of the larynx and connects to the trachea inferiorly. The epiglottis is the large spoon or leaf S-shaped projection superiorly into the pharynx. The glottis which is inside space between the vocal cords. The vestibular folds are the false vocal cords. The vocal folds are the true vocal cords. The cricoid cartilage, the most inferiorly placed of the 9 pieces of cartilage. It marks the end of the larynx. The tracheal cartilages are anterior and lateral walls of the trachea that form C-shaped rings. The trachealis muscle on the posterior aspect of the trachea. The trachealis muscle and elastic fiber join the C-shaped rings. Moving along to the trachea, we have the hyoid bone, the larynx, the trachea, the primary bronchus, and the secondary bronchus.
This curving surface would be underneath the ribs. It refers to the costal surface. The surface that faces the mediastinum is called the mediastinal surface. The narrow upper part of each lung is the apex. The right lung is divided into 3 lobes: superior lobe, middle lobe, and inferior lobe. The superior lobe is separated from the middle lobe by the horizontal fissure. The middle lobe is separated from the inferior lobe by the oblique fissure. The left lung has only 2 lobes, inferior and superior. These lobes are divided by the oblique fissure. The left lung has a notch referred to as the cardiac notch. The base of each lung rest on the diaphragm.